Thanks, Andrea. So now we're going to talk about the communication within the medical record. The medical health record is the primary record of a patient's health and treatment course. It is important that the medical record is clear, consistent, and accurate. Eligibility issues of the past have decreased with the advancement of electronic health records, but the content of the medical record still needs to be clear. Clear and consistent and accurate documentation in the medical record is important for a number of reasons. It is important for future treatment and for future providers so that they are aware of what happened and what has not happened in a patient's medical history. Communication across the continuum of care depends tremendously on the documentation physicians and other providers enter into the record. For example, if a patient had a bad reaction to anesthesia after a procedure, this is information that future anesthesiologists should know in order to alter any future treatment plans to avoid, minimize, or prepare for any adverse effects. Clear and accurate documentation is also important for legal reasons. Since the medical record is and serves as a legal document, it should be composed of legible, clear entries that will support patient care and promote patient safety. But aside from clinical care and the care of the patient, clear and accurate documentation is very important for billing. The quality of clinical documentation plays a major role in the manner in which a chart is coded and billed. Hospitals depend on accurate and complete physician documentation in order to optimize reimbursement. Coders depend on a clear and accurate documentation in order for them to code to the highest level of specificity, which will in turn group these codes into higher DRG assignments, giving the hospital a higher reimbursement rate. Without the proper documentations, coders are undercoding services, and many major comorbidity conditions are many times missed due to this behavior. The lack of sufficient documentation that is clear, concise, and accurate to support patient conditions and services performed can also cause a facility to fall outside of audit and reviews conducted by different outside and regulatory agencies. Hospitals depend on this accreditation from outside or regulatory agencies for reimbursement. Basically, if it's not documented, then it didn't happen. This is where the role of a clinical documentation specialist fits in. A clinical documentation specialist can be classified as an individual who will serve a facility in the role of reviewer, educator, and liaison between the physician, the medical record, and the facility coders. Clinical documentation specialists serve a medical facility by being able to identify inconsistencies within the medical record that can be addressed by the physician or providers before the chart goes to coding. Clinical documentation specialists can review records while the patient is in-house and develop a process to help educate both physicians, nurses, and providers in documenting in the record. The primary benefit to having a clinical documentation specialist assist with documentation in the medical record is that it leads to clearer, more consistent, and accurate information for future providers. This allows providers to get a full scope of the patient's history in order to provide safe and quality care. Clinical documentation specialists can also help in identifying any unintentional or careless behavior on either the clinician's or physician's part that can be captured pre-billing as opposed to afterwards. This would eliminate coders wasting valuable time or errors slipping through the system, which would in turn reflect on the denial rate. By managing the documentation of physicians, clinical documentation specialists would ensure that a more accurate and consistent documentation for billing and coding purposes is available, which can lead to higher revenue for the services rendered by the facility. Clear, accurate documentation is also important for the case mix index of a facility. A case mix index is a relative value that is assigned to a group of patients in the medical care environment. The case mix index value is then used to determine the allocation of resources for care or to treat this certain patient population. The case mix index of a hospital reflects its diversity and clinical complexity and the needs of the population that they serve. So this value can be used to adjust the average cost per patient for a given hospital. relative to the adjusted average costs by other hospitals. So basically, if a hospital documents that they treat a higher acuity patient, a more complex patient, they will get more money back for that patient rather than treating a patient who is healthy and get the standard amount. But this could only be done if the documentation is clear and is there to support their findings. So if documentation is not accurate, consistent, and complete, the medical facilities would not be getting the amount of money per patient that they warrant. And this could only be determined by documentation from a previous encounter or a current encounter that is accurate and clear for coders and any regulatory auditors to provide.